Hello, everyone. My name is Ryan Rose, and I'm here with Tiffany Foss to talk about the dentistry field. So, first question, what do you do exactly in the dentistry field?
So I'm a dental assistant, more specifically an expanded functions dental assistant. So I'm chairside with the doctors, but we do a lot of the work as expanded functions. So they'll do the drilling and that kind of thing, but I place the fillings. I'm taking impressions. We're making crown temporaries. We're digital in our office, so we're a lot of digital scanning and that kind of thing.
Okay, that's cool. How did your journey start to become?
So I actually didn't want anything to do with the dental field. Like a lot of people, I was scared of the dentist when I was younger. When I graduated high school, I started out with nursing. I never wanted to be a nurse. It's just do something, so that's what I chose. After I realized a couple years in, I didn't want to be a nurse. I was like, well, you have to go and do something. So I went to school for massage therapy. So I'm actually also a massage therapist. The dental office I work for was hiring for a hand massage therapist for their hygiene appointments. So I applied and I got in, and so that's where I started, being a hand massage therapist for a dental office.
That sounds very confusing. How do you go, like, you were a hand massagist to
So yes, so when you were getting a cleaning, you're there, so we would have a hand massage therapist come in. We still do. I don't do it anymore, someone else does. It kind of helps to relax the patients. Patients love it. I think it's probably one of the only dental offices in the area that offer that. But so from then on, I was trained to do multiple things. So that's how I worked my way up to assisting from that job when I was only 20 years old.
Oh, that's cool, I'll admit. Since the doctor just comes in or the dentist, sorry, the dentist comes in and out with the drilling, you deal with the patient mostly. How do you deal with an anxious patient?
So, there's a lot, first and foremost, just talking to somebody, making them feel comfortable, sympathizing with them. That helps a lot. But to go a little even further, we offer nitrous oxide. A lot of people know that as laughing gas. That helps tremendously. We also have a therapy dog that can help with anxious patients. Now, they don't go back to the chair or anything, but they will once a patient comes in, if they say, I'd like to meet, her name is Tully, and spend some time with her before their appointment. And that actually really helps patients as well.
Oh, so for the therapy dog, is it through your business or is it?
So she is completely certified, and she goes to not only our office, but other, like she does hospice for cancer patients and things like that. So she's completely certified. She has all her medals, everything she needs. So she just comes in like once a week.
Oh, that's cool. So how do you deal with dental emergencies? Like, what is an example of? Also, what would be an example of a dental emergency?
So there's always things, we do sedation. So we have to be careful with people's breathing, and we monitor their vitals at all times when we're doing sedation. We've all been trained in CPR. I've been trained in like special dental emergencies as far as someone like having a heart attack or having a stroke. So, those are things you hope you never have to use, but yearly we are trained in case those kind of things happen.
Okay. What is the most challenging part of your job, and how do you overcome it?
Our office is very busy, so we work very long hours. I work 13-hour days, and our schedule can get really hectic. You have to be really good at time management and knowing when things are going to end, when the next one's going to start. Are you going to have all the materials you need? Is the doctor going to be on time? There's lots of little things that go into your day other than just sitting chairside. So you have to think about all of those things ahead of time and just anticipate what your next move's going to be.
Okay. You said you work 13 hours a day. How do you balance your home life and your work life? Because 13 hours is a lot.
It's a long day.
It's a lot of time from home.
Yeah. So I do 2 13-hour days a week, and I've been doing it for 23 years. It's tough. Like, I'm tired when I get home. I try to communicate with the kids and my husband through text throughout the day. And then when I come home, they all know mom is tired. So it's a quick, how was your day? Do you need anything from me? I'm going to bed. So they're good about it. My husband's good about it. So, but I'm not gonna lie, it's tough. But I get through it. I've been getting through it. Now I'll keep getting through it.
That's good that you found a process that works for you and you can deal with it at home. That's really cool. What skills have you learned being an assistant? What was the, sorry.
It's an assistant. That's
assistant. What skills have you learned being assistant that helped with your personal life?
I feel like I can be a little bit more patient because when people are at the dentist, no one loves the dentist. No one wants to be there. So we have to be patient. We have to be sympathetic. So I can kind of carry that into, my normal life, anticipating how people are going to act, and just having the patience for other things outside of the dental field.
Okay. What would some advice be to somebody that's looking into dentistry?
I would say go for it. The position I hold, a lot of people don't know about it. They're not aware of it. So if someone's interested in dentistry, I'm all for it. I'm there to help. I've even tried to tell my children, why don't you guys go into dentistry? Neither one of them want any part of it. But it's a really good field. You get satisfaction at the end of the day seeing the work that you've done, the people that you've helped. It's also good in the fact that, we don't, 13-hour days is tough, yes, but we don't work nights, we don't work weekends, you don't work holidays. That's a plus for somebody wanting to have a good career, but not wanting to say do like the nursing things where you have the nights and the weekends and all of that thing. So I am 100% for people wanting to go into dentistry.
Okay. So or do you work with people, I assume? You work with others.
Mm-hmm.
How do you communicate with others in the dentistry? Because I'm sure, so you said it's pretty busy.
Mm-hmm.
How do you, because you guys get multiple patients.
Mm-hmm.
Do you guys communicate? Do you guys have meetings every day? How
We
does
do.
that work?
So we have our morning huddle. That's what we call it. We kind of go through our schedules and to try to see what's going to come and how we're going to do things. The group of girls that I work with is fantastic. We work very well together. But you have to, have that good communication in order to get through your days. We've all been there for a long time. Some of the girls have been there longer than I have, longer than the 23 years. So we, as a team, it's like a well-oiled machine. We can get through it. We're there when somebody has a tough day. And then, someone's there for you when you have your tough day as far as, there's always obstacles that you run across. Patients that don't go as planned, procedures that don't go as planned, you're running over, you didn't get your lunch. There's always those little things, but having that good team behind you really gets you through those days.
And it probably taught you teamwork as well.
Absolutely.
The value of that.
Mm-hmm.
So you said you're an assistant. Have you thought about anything else in the dentistry field?
I haven't. When I was a little bit younger, I thought maybe going to hygiene school, so that's where they clean their teeth. But I really like what I do because it's so different every single day. You don't get the same procedure every day. Everything is different. Every patient is different. And I really love what I do.
So since every patient's different, how do you deal with different patients that come in? Because somebody might be anxious, somebody might, because you probably deal with somebody that's 5 to
Absolutely.
90. How do you deal with those patients? Because that's a different atmosphere, every patient.
Yeah. So you kind of, you bring your patient back into your room. I always, introduce myself. You'll kind of get a read for how they are. If someone's really anxious, you're going to know that right away. If someone's happy and they're not scared to be there, you just kind of start conversation. We sometimes get the patients who are anxious and scared, and they can almost come off as rude. So that's a tough thing to deal with when someone's being rude and I'm just trying to help you. But in the back of my mind, I got to remember they're not being rude. They're scared. And so any way possible, I try to open up to them, find something that I can talk about to them, in the short couple of minutes we have before the dentist comes in to help them relax and help them just realize you're only going to be here for a short time. Everything's going to be okay. It's not scary. So that seems to work.
Have you found anything difficult with communicating with the patients? Because there's probably some patients that don't talk at all, that are just there.
If you can kind of get that feeling from somebody, and you kind of just let it go. You don't really do a lot of talking. You kind of explain the procedure, but you don't get into any conversation. If they don't want it, you kind of get that read from them, and you just let it go.
Okay. Is there anything else to explain about the dental field? Because you do most of the work. Is there anything
I would just say that a lot of people are scared of the dental field, but we work well together. It's a great field to be in. I would advocate for people to kind of check it out and not to be so scared of going to the dentist because it's not so scary.
Okay. That's all we have. how did you? I know you said you were nervous.
Yeah.
How'd you like it?
No, it was great. You did a great job. And yeah, it kind of just flowed after a little bit.
Yeah, that's how it works. All right. Thank you for joining us.
Yeah, thank you.
Have a good day, you guys.